Well, developing now, the Indiana Hospital Association is warning Hoosiers that the healthcare system could be nearing a breaking point.
The state is seeing a record number of COVID-19 hospitalizations right now. CBS 4's Kelly Rinke shows us why everyone should be concerned about staffing shortages at hospitals right now.
We are able to manage it much better than we were in the spring. The problem now is just the numbers.
The change in seasons is presenting a new challenge for Indiana hospitals.
Fast forward to today, and the supplies of PPE, the ventilators are there. Those are stable. We know more about how to treat COVID, but staffing is really challenging right now.
Brian Tabor is the president of the Indiana Hospital Association, one of many in healthcare concerned about the record number of COVID-19 hospitalizations.
I think the fear is that the system essentially gets overrun, and that sounds very scary, and that's why we're ringing the alarm right now.
If the trends continue this way, Tabor believes that breaking point is possibly a few weeks away, especially since hospitalizations lag about 2 weeks behind the rise in COVID cases.
It's about making sure that you protect the system so that you have a stroke or your loved one has a stroke, you don't have to worry. You know that they're going to immediately be seen and get the best care.
Hospitals are losing staff to quarantine or even retirement.
The staff are just tired. You know, they're very, I would say almost to the point where they feel a little bit defeated, right?
The biggest concern at Schneck Medical Center in Seymour is making sure patients are cared for.
Anytime we don't have the appropriate staff or the appropriate number of beds, then we may not be able to keep our patients.
That is why our frontline workers are begging you to follow the guidance.
Or whether that's down in Kentucky or up in Michigan or Illinois or Ohio, they're all busy too. So there aren't troops that we can kind of call in to staff up the hospitals.
In Indianapolis, I'm Kelly Rinke, CBS 4 News.
Indiana has established a healthcare reserve workforce. Volunteers will provide additional support to both hospitals and long-term care facilities. The state is still asking more people to sign up. You can find more information online at cbs4indy.com. Just look for this story on our homepage.